It's Nikki with So You I've been wanting to make this for a while. So, as many of you know, I'm going to school to be a psychiatric mental health nurse practitioner. And if you're following this case that's going on, I want to share what I want to do moving forward with my patients. Because as I'm watching this, I see it from a mom who had postpartum. I also see it looking at it from the lens as a soon-to-be psych provider. And the one thing that makes me really sad about all of this is just the lack of continuation of care. But not only that, having one provider who actually cares about you. And as someone who's going to be a psych nurse practitioner, I will want my patients to know that I actually care about you, and that I actually want to help find solutions or ways to help make you feel back to a normal again. With postpartum, it's different because your hormones are all over the place, and there's a lot of things, moving parts that, sleep deprivation or breastfeeding or maybe going back to work, all these things, but wanting to make sure that my patients feel like they are being seen and they are being heard and that we are working together, because it's just so important to have that care, to actually care about your patients. But I have just been watching this case, and it's just been very difficult to see, just as someone going into this field, there's so many questions I have. And then as well as someone who had postpartum depression and rage and anxiety and OCD and intrusive thoughts, and just I remember when my husband worked shift work, I would go and check the doors and the windows 3 times when he would be at work. And I didn't have to. That was just one thing, but it was always worrying something bad was going to happen. If my kid got a cold, and then I had an older sister who died from spinal meningitis, so if my kid had a cold, I was immediately they have spinal meningitis. But it was that extreme. And your mind is so powerful. But I hope if you are struggling, I hope that you find a provider who really cares and who really listens to you. Because there are providers out there that really do care and really do want you to get better. And I hope my patients feel that with me. So anyways, I hope you're taking care of yourself. And I hope if you're needing good mental health care, I hope that you find a provider that works with you, and that you guys mesh well together. So anyways, Joanna, Chuck Norris, be kind. It's not hard. It's not hard to be kind.